My name is Dickson Adetoye. I work with APIN Public Health Initiatives, Nigeria, and I'm here to talk about advanced HIV disease and other predictors of treatment outcome among newly diagnosed people living with HIV in Oyo State, Nigeria. It has been said over and over again in this conference that the rate of new infections are not declining as expected. The same can be said about the rate of health-related death. Even though it is declining, but it is not doing so as we expected. This is despite the number of people that we've been able to place on ART. And we know that from data, the decline has been slow due to factors like delayed diagnosis, delayed in enrollment, interruption in treatment, and treatment failure. And all of these have led to advanced HIV disease. We know that advanced HIV disease is also linked to increased morbidity and mortality, and WHO has defined advanced HIV disease as CD4 less than 200, or WHO stage 3 and stage 4 in adults or in people 5 years and below. So what we wanted to do was to first assess AIGHD diagnosis prevalence among this cohort of people, and to also evaluate treatment outcome, and then we also wanted to see if AIGHD predicts this outcome, and then to determine if there are any other predictors. So what we did was to do a review of program data for clients who were enrolled between October 2021 and September 2023, and we look at this data, and then we analyze using SPSS. We defined treatment outcome as we're looking at viral suppression and continuity of treatment. And what we found after enrolling over 15,000 participants into the study, more than about 2/3 were female, and the diagnosis of AIGHD was around 21%. We saw that 96% were retained after 1 year, even though some of these clients interrupted treatment sometimes within this period, but 96 were retained. And then we had 90% of those who were retained had documented viral load, among which 93% were suppressed. What we found was that AIGHD did not actually predict viral suppression, but it predicted survival, so to speak, because people who were AIGHD diagnosed were more likely to die than those who were not AIGHD diagnosed. It means that if we're able to keep them alive, their viral suppression does not differ from those who were not AIGHD diagnosed. We also found that age, fertility type, and all of that were also some factors. So just to say again that, as has been said again and again, that prevention of new infections or new acquisitions, early diagnosis are still the most effective ways of preventing morbidity and mortality among PLHIVs. Thank you very much.